Hi, this is Amber Healy, and this video will cover CGM billing as part of our series on CGMs for the Southeast Ohio Regional QI Hub. Our objectives for this video will include reviewing the criteria needed to bill a CGM interpretation, what documentation that includes, and then a review of the CPT codes that are used to bill for CGM interpretations. So what do we need to bill for a CGM? So first, the billing must be completed by a physician, an NP, or a PA. Support staff are able to download these and provide you with the interpretations, but the billing has to be done under the healthcare provider. The report must have at least 72 hours worth of data on it. So if your patient placed a sensor 24 hours ago and they're in your office today and there's no data otherwise to look at in the frame that you have pulled for your interpretation, you cannot bill for it. You can help the patient if there's data enough there to make a clinical decision on a medication change, but you can't bill for it. The other thing that you need to do is make sure that you have documented details about the report. I like to include the date range and then also how much time they're in the different ranges: time above range, time below range, time in range, and then the percentage that the sensor has been active. So if you have someone with an intermittently scanned CGM, they might have 68% of their data present because of not scanning regularly. Whereas someone in the real-time CGM, you might see that they've worn the sensor 7 of the last 14 days, but that does give you a sense of how much data you're looking at and is a detail that should be included as part of reporting on this interpretation. The other thing that needs to be included are any recommendations for medication changes that are being completed. So the patient's blood sugar goes high after a meal, so you decide to increase their mealtime insulin because that's the pattern you saw on the ambulatory glucose profile. Or the patient dropped low overnight, I'm going to decrease their long-acting insulin to prevent hypoglycemia. So those are things that need to be included, especially in the assessment and plan if this is part of an encounter. Otherwise, it's included in an interpretation if you pull this separately outside of an office encounter. The CPT codes we use for interpreting CGMs are included in this table below. So the first one, the 95249 code, is when the patient provides the equipment and then they are trained on it in the office, whether that's helping them with placement, hookup, calibration of the monitor. And then this can actually only be billed once during the lifetime of the patient's receiver. And the second code, the 95250 code, is where the office provides the patient with a sensor. So this is like the professional sensors, usually where they data may be blinded to the patient. Part of that is you'll have the patient put on the sensor. They have to have at least 3 days worth of data. They bring it back to the office. Your staff downloads it. They can send the report to you, and you as the physician, the PA or the NP, interpret it. And because this is a procedure that they're doing under your supervision, you can bill for it. The most common CPT code that's used for CGM is the 95251 code. And this is where the patient is wearing their CGM. They have at least 72 hours of data like we discussed. And then you do an analysis of the interpretation report, which we've gone through in other videos. If it's done outside of an office visit, you just bill the CPT code. If you do it the same day as they are in the office, which is what happens most of the time, you need to put a 25 modifier on it to show that it is a significant separate service that has been provided on the same day as that office visit, and you would bill your office visit like you would any other follow-up visit. The only caveat to this is that new G2211 code cannot be used alongside a 25 modifier. So if you are using the G2211 code, this is one time where you would probably rather get credit for your CPT code with the 25 modifier. So some other things to keep in mind with CGM interpretations is that CGMs are great tools for remote monitoring. So even when a patient is not physically in your office, as long as their CGM has been connected to your office, you can pull reports if they call in with a glucose issue, and you can bill for those interpretations. You cannot bill more than once per month per patient. And then if anyone was curious about work RVUs, each CGM interpretation is worth 0.7 RVUs. Thank you for your attention to this information. If there are other questions you have about CGM or feedback for the Southeast Ohio QI Hub about further educational materials you would like to see, please let us know.